Hello, Facebook Live, uh, CMO at CGH Medical Center in Sterling, Illinois. Thank you for joining us. And the format we're going to have today is I have Corinne King, who is the director of our dietary and sleep. Oh, there she is. Hi, Corinne.
Hi.
So Corinne's going to join me in a little bit here. But the first thing that I'm going to do today is we're going to talk through some pandemic COVID related stuff, vaccines, and then we'll go to Carenza and my conversation, and then we did another field trip, which I think you'll get a kick out of. I went through our fresh cafe with Carenza and some of the folks that we got a chance to chat with. So we'll do that after she and I sign out. So let's start with some stuff related to COVID. First of all, um, I our results here at the hospital. We've done 17,407 tests. We've hit the infamous 3,000 positive number. Now we have 3,009 of those tests have been positive. By the way, I remember when we went from 3 to 9. That's right, 3 to 9, and I thought that was a big jump, which it was, but 3,009 right now. And we've had 14,298 negative tests. So that's where we're at in terms of CGH. Matt, you want to put up what we have for data here? Yeah, there's the some county stuff. Our death count has gone up, and I think you had would you have another piece of information? So I wanted to give a shout out to one of our viewers. Steve Temple works here at the hospital, and Steve has a really good analytical mind and really is into and does a good job with numbers. And he found this site for us, which I think is really, really helpful in terms of getting even more in-depth information about where we are as a county, how the state is doing. So yeah, I'm just going to see here. It shows our average daily new cases and how much ICU bed capacity and positive test rate. Which by the way, that positive test rate of 5.7% is really that's really encouraging compared to where we were at in mid-November. So that's really good to see. And if you go down there a little bit, Matt, it shows us compared to other counties, and by and large, we're trending fairly similar to others, a little bit higher perhaps, and keep going down. Yeah, keep going down. Yeah, so this I thought was a nice little graph. It just kind of shows that peak as we went from like October through November and kind of shows where we're at now. Yeah, yeah. So you can see at the peak of that and then where we're at now. Now the one thing that I'm encouraged by with where we're at now, maybe scroll down a little bit further, Matt, just so folks can see that. Yeah, infection rate, that's really gone down. And then the positive test rate, that we were at 25% range in mid-November, and you can see where we're at now, which is really encouraging. I say all that to say that we still need to be very diligent about doing all the right stuff in terms of wearing our masks, because until we get vaccines into a lot more people's arms, what I'm reading is this new variant, which is it's more infectious. I think what they're saying is they think we're going to go down in terms of our infection rate for a little while, but that new variant is going to get more of us sick until we get the vaccines in people's arms, so that doesn't happen. So it just means that even though people are getting the vaccine, we still need to be really diligent. I'm curious to see now that the state, for our region has changed our mitigation level. What that's, I think it may, I agree with it. It's just with this new variant beginning to take hold, which I know they've at least had. Northwestern runs these studies, and I know they had. I think it was Monday they had identified the first one that Northwestern identified this past Monday. So there'll be more of that variant going around. So anyhow, point is that we may go down. There's a chance we might go up a little bit, and then we'll see how this whole vaccination stuff plays in terms of beginning to pull that back down, hopefully permanently. Right now, I like where the president is going in terms of trying to get in 100 million vaccines into 100 million U.S. citizens in the next, uh, um, yeah, 100 million vaccines in 100 days. Like it. Let's get that going. Here at the hospital, in terms of vaccines, we have not had this. I'm hoping any day we'll get this huge supply of vaccines, but we don't have that right now. So speaking of vaccines, right now we are doing, and Matt will show this here. We are doing a list now where you can sign up on that list, and it's kind of like when we have information for the vaccine, we will let you know and get vaccines to many people as quickly as we can once we get vaccine to us. Uh, it's still not quite all together in terms of when we're going to get some and who else is going to have some in the area. I do know other people in the area, different health departments are receiving it. So, yeah, as we have information, we'll let you know about that. There was a question that was sent to me before the broadcast, and that was about if you're from a county outside of Whiteside County, but you are, go to see someone at CGH, would you still be able to get the vaccine at CGH if we have vaccine available? I, I'm not 100% sure on this, but I'm pretty confident that if you're part of our system and you're entering your name and you're able to enter your name because you're part of our system, that even if you were in Bureau County or Carroll County or wherever, that we would be able to get you a vaccine. Don't hold me to it, but I'm pretty sure on that. One other sobering thing that just continues to be one of the reasons that we're continuing to have to work hard about doing all the right stuff is our U.S. death count. I just looked at it today, and 406,196. If I remember right, I think we were at 300,000 a month ago. So, definitely ramping up with the number of deaths across the country. So I don't say that to scare anyone. That's the reality. That's where we're at. And if we continue to do the right stuff, we're going to slow that down. So I'm hopeful for that. I hope that's going to get slowed down, but it's one of these kind of slow moving things to get back under control. So it's going to take a little while. All right. So as we've done in the past, if you have questions as you're watching and you want to send those to me and to Carenza as we're going through our conversation, whether that's about COVID and vaccinations or it's something related to our dietary services, I encourage you to do so. We enjoy getting those questions and trying our best to answer them. So, with that being said, let's get Carenza on here. Hi, Carenza.
Hi, Dr. Bird.
Welcome again.
Thank you.
So, Carenza is the manager of what's your official title? I always butcher these things, Carenza. What is it?
Oh, it's fine. I like to refer to it as food and nutrition services because we're over the cafeteria and the patient room service program, as well as the clinical nutrition aspect of what we do here.
Sounds good. For some reason, like you started talking and I can smell food. I don't know where that's coming from. For the folks that are on the program, we get to talk about food today. So that's good.
Right.
Lunchtime, let's talk about food. So let's start this conversation just kind of like some nuts and bolts stuff, Carenza. How much food do we go through in a year at the hospital?
It's quite a lot. We have a primary vendor, Cisco Foods, and last calendar year, 2020, we purchased nearly 18,000 cases of food.
And again, how many cases?
18,000 cases of food and supplies as well, our disposables and whatnot. Our secondary vendor is Gordon Foods out of Kenosha, and that is included in that total. So between 350 and 375 cases per week. In addition, we have a bread vendor, a dairy vendor. We've got 3 beverage vendors. So we've got trucks coming in and out Monday through Friday from various companies throughout the Sauk Valley area. And
Yeah.
it's a lot to manage.
Yeah, we're very vendory.
We are.
Yeah. Okay. That's a lot of food. It's a lot of food. So how do we manage? We get a lot of food in,
Yeah.
and then we have obviously our employees, but in addition to employees, we have these patients that are in the hospital. And can you speak a little bit of how your team keeps track of all, who's on a diabetic diet, who's on a low sodium diet, and all those kind of, how does your team manage that?
Yeah, it's quite a lot. We've got at any given day, between 40 and 60 patients who eat, 3 to maybe 4 times a day, or depending. So we're sending 150 to 200 patient meals up between 6:30 in the morning to 6:30 at night, which can range from a cup of coffee all the way up to a salmon or meatloaf meal.
Yeah.
And additionally, in the cafeteria, pre-COVID, we had about 1,000 transactions per day. Now we're down to between 650 and 800 on a good day, but still quite a big volume of food. We've got a room service application called Seaboard that we use in conjunction with our clinical medical record, Cerner. So when a physician enters an order for a patient diet, then that crosses over via interface to our Seaboard system. And that will help guide our call center staff to guide what those patients are ordering. So for example, if they require a sodium restriction, or if they're diabetic, or if they have a fluid restriction, it will help us. It shows foods in red that they shouldn't have or that we should limit. And then foods that are okay are in the normal font. So we keep track of their calories and their carbohydrates if they're diabetic, and then their volumes of fluids that we send throughout the day.
Yeah. So, yeah, I mean, you covered that in a couple of minutes. I'm telling for the folks who are watching, this is a big undertaking about getting the right food to the right people, the right, all that kind of stuff. It is so your team does a really nice job and has to use some technology to make that happen along with the people.
Yeah,
Your
they sure do.
department. And when we do our field trip here, when Corinza and I are done, you'll get a little taste of how that works. Some live footage, not live, but like video footage of how that all plays out. So one of the things you alluded to, Corinza, was on demand. So tell the folks who don't show up to the hospital that much and aren't familiar with our hospital food service. What do you mean when you say on demand?
Mm-hmm. We have, as opposed to a tray line where there are 3 set times for meals throughout the day, we have a room service platform where our patients have the opportunity to order off of a menu as if they were in a restaurant. So from 6:30 in the morning until 6:30 at night, they can contact our call center and place their meal order with the assistance of those staff who can help weed out what they can and can't have, or should and shouldn't have. And then, they aren't set to a specific time. There are patients who have tests in the morning and they aren't to eat anything perhaps after midnight the day before. So then by the time they're allowed to eat at maybe 11 a.m. or even if it's past lunch, we absolutely give them that opportunity to order. And we do offer breakfast all day long. And lighter fare, of course, in addition to some of those more robust meals. So, we have a lot of options for patients who might not feel like eating a whole lot, or just might want something, more simple with the conditions that they're enduring.
I didn't know you guys did breakfast all day long.
We do.
One of my favorite meals is breakfast for supper or something like that.
Same. Yeah, we do that at my house for sure. So, yep.
Okay.
And that liquid eggs actually are our 3rd highest food purchase, right behind chicken breasts and unfortunately bacon. We buy a lot.
Not if you're a pig farmer, but
right. And I grew up on a dairy farm, so I get it. Burgers ground patties are up there too.
Sure. So one of the things that I don't know that folks probably realize, I didn't when I first, probably for the first 15 years I was here at CGH is we actually have a chef in your department.
Yes,
So
we do.
tell me about that. What is the chef's role in our food service area?
Yeah, we are very fortunate to even have a chef, and we are blessed with Chris Holloway, who you'll meet in the subsequent video. He's just very talented chef, and he's got over 30 years of experience. We work very collaboratively with Chris. He has a lot of great menu ideas. So on a weekly basis, he and our management staff get together to plan out the menu for the week. So usually every Tuesday or Wednesday we sit down and we have a 4-week cycle menu that we make adjustments to, but we look ahead and, based on the popularity of certain items or, the demand of others. Certainly there are things that we don't as dietitians like to offer as often, but we would be crucified if we didn't have chicken tenders or some of those things. But he shares his ideas and his thoughts on how we can, spice things up or make things a little more, I guess, attractive to our customers. And that's as opposed to our room service cooks on the patient side of things, who need to really stick with consistency and portion sizes and those therapeutic diets. So it's nice to have someone with some experience to be able to offer those kinds of options mainly to our employees. And we miss our customers who aren't able to visit right now from outside of here. I know a lot of teachers used to come to our salad bar and over their lunch hours, and some of the community members would like to just eat here, but we've obviously had to limit some of that. But yeah, Chris does that. And in addition, we've started a program through just for our employees with family meal offerings. So we're up to a couple of times a week where Chris will give us some ideas of what we can put together and let our employees purchase to take home to cook for their families, to take some of the burden off of them as they likely have longer hours and more stressful days here with COVID.
Yeah, thanks. And one of the other things that I think, at least I think folks might be interested to hear, is that our dietary department, our cafeteria, you're a dietitian, but we also have a dietitian, Michelle, who is going up to the floors and helping out our medical staff, our doctors, with patients who have certain issues with being able to feed or, all these kind of things. So can you kind of talk a little bit, and you're a dietitian, you can speak to this, I know very well, what exactly it is that Michelle does, and how has COVID changed that, if at all?
Yeah, and it certainly has. So when a patient is admitted to the hospital, the nurses go through a rigorous screening tool for each of our patients. And since it's electronic, there are various questions that they cover that would perhaps trigger a red flag that patient might need some nutrition intervention. And Michelle, it's a unique position because she's really the only dietitian on any given day. We do have someone who comes in every other weekend, Deb Van Zuden, and then I will cover as well. But it's not like nursing where there are, many on the floor. She's a one-woman show for the most part, so I appreciate her efforts there. She's a very hard worker, and she will review a patient's chart, looking at labs, their weight history, of course, their clinical history, if they have diabetes, if they've got congestive heart failure, et cetera, and then how they're eating or not eating. And then based on that, she will provide recommendations to the physician. Perhaps someone's lost significant weight and they require a supplement to help them along, or perhaps education if they're a new diabetic, or if congestive heart failure is a new diagnosis. Now they need to be concerned about their fluid volumes and their weight and things like that. So we cover a variety of things.
Yeah. So talk a little bit about this COVID, and we've talked about this a little bit, Corinza. What adjustments and what things has she learned and have you learned about taking care and trying to give COVID patients the best nutrition we possibly can?
Yeah, we've certainly faced some challenges, as all areas unfortunately have with this. So it's sort of it's staged in a way, and I'm sure the other allied health professions would agree. When a patient presents, if they're not, they're ill enough to be in the hospital, but not so acutely ill that they require critical
Hmm.
care, they would, maybe they've lost their appetite. That's one of the big symptoms of COVID. And so perhaps they've already come here having lost some weight, their appetite is not good. When you generally just don't feel well, you don't feel like, eating as much. And then, so offering supplements, trying to encourage people to eat to just maintain their weight. And then the next step is when they have struggle breathing, so they're on maybe a heated high flow device, and they have the opportunity to stop and start and can still eat. It really gets tricky though when a patient requires to be moved to the critical care unit and they require a BiPAP mask.
Yeah.
And some of these patients need it
All
constantly,
the time. Yeah.
and not be able to take that off.
Yeah. So this is like a seal. That's like a really tight seal mask that they're wearing. Yeah. And my
Exactly.
understanding is to eat, you have to kind of put something in here usually. So
Exactly. So we struggle with that. So and if you have the choice, right, between breathing and eating,
yeah.
you're going to choose to breathe. So
Right.
we struggled with that. And there's other mechanisms besides eating to get calories and nutrition. Two being the an NG feeding or nasogastric feeding, where a tube literally goes down your nose and into your gut. But when you have that BiPAP mask on, you can't maintain that seal as effectively if you've got even a small tube, out the side. So alternatively, we have parenteral nutrition, which is basically IV feedings. So we've got some issues there because it's a little more invasive. You don't get as many calories and protein through an IV in your arm, and we have to consider fluid volumes as well. We don't want to fluid overload these patients. So ideally, if you've got a BiPAP mask and you can have a central line placed in a bigger vein, then you can provide more nutrition that way. But that's also, again, not something that you want to just jump to for everybody. And then last ditch effort, obviously we're trying to keep these patients off the ventilators, but if they are ventilated, they can have a nasogastric feeding tube and have,
We want to use the gut if we can.
Absolutely. Yes. Absolutely. So again, we just follow the patient's clinical course or progression to see, at what stage they're in. And God love our nurses. If there is opportunity where that BiPAP mask can come off, their priority is to grab a can of Ensure or Glucerna or whatever supplements that we have available, and they will get that into those patients who are able, so that they get something into their body.
Yeah. Good. So, Carenza, what's your story? How did you end up deciding to become a dietitian and kind of pick that as a career?
Yeah. So I really enjoyed high school biology. It was, a time in my life where, you do start to wonder, you're like, well, I don't know what I like to do, or what I like to do. And I fell in love with that subject. So when I went off to college, that was my major initially, with the thought that perhaps I would go pre-medicine. But the school I went to was a small liberal arts college, and they had a really nice nursing program and pre-physical therapy, pre-occupational therapy, dietetics, and I investigated what dietetics was. This was before the internet, so I'm dating myself. You couldn't just Google what a dietitian was.
Yeah.
And so I did some investigation, and I thought, I was always interested. I don't know if this is, I'm probably alone here, but before the nutrition facts labels that are seen today came out, I was always so frustrated looking at food packages in my teens. You just, they're like, what's even in this? How do we know? So it was an interest of mine. I was very passionate about fitness. I was on the cross country team in high school. So it was kind of one of those, things, and like, this would be a perfect fit. I know it's something in the medical field, and there are other opportunities in community nutrition, obviously food service, which I've gravitated to now later in my career. So just a lot of great opportunities that this profession offers. And I was very, very lucky that I landed at a school that had a program, because there aren't very many programs for nutrition and dietetics. So. Yeah.
Are you from the area? Are you from?
I'm not. I'm from a small town in Wisconsin, Lancaster, Wisconsin, and I went to college up in La Crosse. I landed here almost 24 years ago, and there was an ad for this job in the Wisconsin State Journal, where my boss, Cindy Zander, who is also from Wisconsin, had advertised for. I
Oh,
still have the newspaper clipping in my scrapbook, actually, when we still looked for jobs in newspapers and not the,
yeah, right, right.
not the internet.
Yeah,
So I was going to just be here for like a year because my then fiance, now husband, had a year left at Platteville. He's an engineer. And so I was going to move, back and
yeah.
do a job in Madison, but I couldn't find a job up there, and he found a job right away down here,
Right.
and we love it. It's a great area to raise our kids in.
And shout out to your husband. He does make a mean pie.
He does. He is. I cook. I can cook. I like. Yeah, and I think it's the engineer in him, but he's very much a perfectionist. And if he's going to go to do something, it's And additionally,
Yeah.
we're both farm kids, but he's got a garden that can't be
Ah,
rivaled. So I'm very
ah,
fortunate when I'm at home. I have a lot of really great
yeah.
meals.
Yeah,
So,
let's talk about that, Corinne. So, as a dietitian,
yeah.
what kind of diet do you? I'm going to pick your dietary brain, if you will.
Yeah.
What do you eat?
Yeah. I'm not as picky as I used to be. I used to be a lot choosier. So this job actually in the kitchen has sort of opened my horizons. So even
Okay.
at my age, I'm a little more adventurous than I used to be. But I feel like I follow fairly close to what like the USDA would recommend as far as dairy farm kids. So I drink a lot of milk and I eat a lot of whole grains, oatmeal and bran flakes. I'm kind of boring at breakfast, but we do a lot of cooking, so we, casseroles and things that incorporate vegetables and whole grains, quinoa, beans, legumes, things like that. Fruits, vegetables from the garden. But I have quite a sweet tooth. So,
So do I.
yeah. So I have to be careful because I'm tempted to.
So do you indulge your sweet tooth on a daily basis, or do you pick and choose your spots?
I probably do. Yeah, I probably do.
You
But
probably do what? You pick and choose your spots, or you try to?
I probably have something every day. But
Okay.
I didn't. Yeah, it's tough.
Okay, it's all right. True confessions. It's all right. That's what we're here for, right?
Exactly. So I'm not the food police. Dietitians have this reputation of being the food police, and like,
Uh,
I don't eat perfectly,
yeah,
but
that does humanize you. Yeah, that's right. Yeah.
it's true. I try, but you try to set a good example for your kids too. But they're
Yeah.
girls at the age where they like to bake, and so
Yeah, I get it. Yeah, right, right.
it's been fun.
So,
But
so for the folks who are watching us,
yeah.
Corinne, do you have like any dietary advice that your 30-second dietary advice for one of our viewers?
Sure. I really hold a lot of stock in intuitive eating. If you approach, your meals throughout the day, really think, am I eating because the clock says 12, p.m., or am I physically hungry? Are you eating, the entirety of your plate because you're truly in need of those calories, or do you feel obligated somehow? Were you a clean plate clubber as a kid and
Mhm.
you were made to finish, or are you, your spouse went to all this trouble to make this meal, and are you just obliging them? Are you getting enough fluids? Are you getting enough variety? We dietitians encourage diets that don't exclude entire food groups. So you need whole grains, you need carbohydrates, you need proteins. Fat is an important nutrient to get too. It's not all bad. So getting a good variety and really, learning your body and getting in tune with whether or not you should eat as much or less or whatnot. So.
Yeah, good. Hey, we got a comment here. Who's Dan's wife works at CGH and she likes it.
Excellent. Yeah, it's very popular. We're trying to grow it. So with a certain shift in staffing, because fewer patients or fewer customers in cafeteria, so we've needed fewer staff members. So what we're doing is we're transitioning those staff members to help our chef to prep more meals. So initially back in the spring, we were doing 50 to 60 meals 3 times a week, and then as volumes increased, we weren't able to keep up that pace, and then now we're kind of reallocating our resources so that we can offer meals more often and then more of them. So,
Good,
yeah.
good. Well, Corinne, it's been great having you, and I'm hoping for the folks who are watching this that they'll take the time to watch our field trip that we did down in your department, because it was fun to walk around and talk with all your team, and they do a really nice job. And yeah, I mean, we have good we have good food here at the hospital. I mean, It's good stuff. So thanks to you and thanks to your team, Carenza.
Yeah, thank you. We are very lucky. We get a lot of great compliments from patients and community members as well.
Yeah,
I'm
yeah,
proud to be part of it. It's a
yeah,
great group to work with, and yeah, they're hard workers and they are very good at what they do. We're lucky.
yeah, for sure. Well, thanks again, Carenza. And for the folks who are watching us, we're going to transition into this field trip. It's a little, sometimes it takes a little bit of, oh, there it is. Maybe this will go off really quickly. You can see our hair nets there. And it was yesterday that we filmed it, so we're in a little bit different attire, but you get the idea. So, all right, everybody, thanks for watching. We'll talk with you again next week. Thanks, Carenza.
Thank you, Dr. Bird.
Hello, Facebook Live. So, Carenza and I were just talking, and you just saw us talking. You saw our faces. Here we are doing a quick field trip of the cafeteria, talking a little dietary with you. Hi, Carenza.
Hi, Dr. Bird.
Hello again.
Yes.
So this is kind of weird because we're doing this Wednesday. We're going to have our conversation Thursday. Right. So no bow tie for me. A little more cash today. So
sporting a hairnet.
That's right, sporting a hairnet. So what I wanted to do, since we actually had someone I wanted to chat with, is we do something at the hospital that I think is kind of nice. We actually bring food. Tell us about that.
Yeah. So years ago, about maybe 8-10 years ago, we still had a platform for food service that used a tray line. So everybody got their meals all at the same time. And years ago, we transitioned to a room service platform. So literally, patients order their food off of a menu like you would see in a restaurant. And we can do that from 6:30 in the morning to 6:30 at night. And we have a series of events that will take place that we can review in a bit. But our ambassadors deliver those trays to our patients throughout the day when they feel like eating or when they're allowed to eat.
So speaking of which, it's what, about 2:40?
It is.
Yeah, which is not, some people want to eat now. And guess what? We're going to have some eating going on. Come here, Deborah. So this is Deborah. And Deborah's one of our folks who brings the food upstairs to folks. So unusual to be taking a tray up to somebody at
this time, no. It's pretty normal.
What's going upstairs?
What's going upstairs? I actually didn't even look. Cheeseburger and chips.
Okay, you didn't hear that on Facebook. We don't do cheeseburgers, too much for the hospital.
Right.
But somebody up there is going for the cheeseburger and chips. They must not be on their diabetic diet.
I think they're general diet.
Okay, general diet. All right. Okay, so general diet.
General diet, yes.
Well, Deborah, thanks for doing what you do. I see you guys all the time, going back and forth, and I know our patients appreciate it.
Thank you.
Okay, go get them.
All right, I will.
All right, she's off to the races. All right, so we're going to stop for a moment, and we're going to go back and catch up with our chef. Hey, I'm back again. We actually have a chef here in the cafeteria, Chef Chris. Hi, Chef Chris.
Hello, Doctor.
Hey, so I wanted a brief story. You've been with us now for less than a year. Where'd you come to us from?
I came from St. Charles at the Q Center.
Okay, all right. So that's like a pretty big area that you were cooking for?
Yeah, it was a large conference center, about 1,000 rooms.
Okay, all right. Chef Chris knows all about cooking for a bunch of different people. That's what I was trying to get at here. Yes?
Yep.
Okay, all right. And we have the other thing I think is kind of unique that we're doing now with COVID that we're trying to provide for some of our employees is and I thought it'd be a good chance here. There's a big pot of something right there. What is that, by the way?
That's meat sauce for lasagnas that we're serving up tomorrow.
Ooh, that sounds good. Okay, so, and we have David back here. Hi, David. How are you? Good. All right, so tell us what we do for our employees to try to help out somewhat during this pandemic.
Sure, we've been doing some of these to-go meals. Tomorrow we're going to be doing about, Dave's making 20 lasagnas. It's going to feed maybe 80 portions of folks. So again, just trying to help out for, all the people that are working extra hours, working really hard, and, maybe they need a hot meal when they leave.
Yeah. So we've been doing that, I would say, since probably March, April-ish for the people that were working.
Yep, sometime in the spring, yep.
Okay. What kind of feedback you been getting?
Well, so far it's been pretty good. Meatloaf's been a big hit. The chicken parmesan and the fried chicken's been good. We're hoping lasagnas are going to go over big as well.
Yeah. So I'm just curious, working in a hospital is first for you to do that?
Yes.
Okay. So what's been, I guess, surprising or interesting to you
working in a hospital versus working at another big venue like the Q Center where you were at before?
Sure. Actually, it's been more home style meals here, I guess, which is great. Nothing wrong with that. Absolutely. So instead of like doing a lot of different ethnic foods and things like that, it's been more kind of centered focused on country home style meals.
Chef Chris, great to have you. Thanks for taking a little time to chat with me.
Thank you.
And he's always back here getting stuff ready for you when you walk through that line. This is the person who's a big part of that. So thank you.
Thank you.
All right. Take care. Hey, we're back in the cafeteria, although it's a little bit tamer in this room, right?
Not always.
Oh, okay. I have Darlis with me. Hi, Darlis.
Hi.
Can you tell us what you do here in the cafeteria in the dietary department?
I work in the call center. I take calls from patients when they order food. So they call all day long. And then I also order supplies.
So we make sure that we have food. So when the patients ask for food, that you have it.
Yes. And I tell them what they can and can't have based on their diet orders from their doctors.
So the cheeseburger and chips, that was okay because they were
That was
general
okay.
diet.
Yep.
Okay, so I guess you're looking for a general diet when you come in the hospital. I'd push for that one if you're a cheeseburger and chips type.
Some people are okay with that. Some people want to tell me different.
Good. So in the course of a day, I know it varies upon how many people we have in the hospital, but how many folks are getting their meals apart from? I'm just curious. Like, I think of like a typical breakfast time is 8, and then lunch is noon, and supper times, I don't know, 5, 6, something like that. How many folks are the special order kind of folks do you see?
Like between meals?
Yeah.
Oh, it depends on the day. Sometimes they don't order at lunchtime, and so they're busy for, the whole time from 2 to 4 o'clock, taking orders.
Like talking to Deborah, like I just did now, right? Yeah. How's COVID? Is it anything been different in terms of what you do in terms of the pandemic?
Just the mask, even in the office.
Yeah.
Yep.
Okay. Yeah. So just getting.
Hand washing, more washing counters.
Yeah.
Keeping things clean in here.
Good. All right. So I think what we're going to do now is you put your stuff together and then you send it off to another area where they put it all together, right?
Right. A ticket gets printed for the cook and one for the expediter who puts the tray together.
Yeah, I think we're going to go expedite.
Okay.
All right. Thanks, Darlis. Appreciate it. All right.
Nice talking.
Yeah. Good talking to you too.
All right. So one thing that changed with COVID was the guest trays. We don't have visitors.
Okay.
So we've
Yeah.
seen a decrease in the number.
Yeah, this is true. Okay. We are in the expedition area.
That's right. We
Tell
got
us-
expedited to the expediter
All right.
area.
So tell us what this is all about here, Corinne.
Right. So once the ticket's been entered, simultaneously print to a printer here and as well in the room service cook area. The expediter then would take a tray and start assembling based on the search from the ticket. So if they need salt packet and crackers, we've got coolers full of beverages and things like cottage cheese and Jell-O, etc. And they have to take much care in making sure that if it's a diabetic, that they're getting Splenda, not real sugar. If they're on a sodium restricted diet, they get a stash, not salt. So it's not just throw it all together. They have to be very mindful about what it is that they're putting on these trays.
You bet. So with the pandemic, or I guess anyone who's on any sort of isolation protocol, how does your team deal with that? Do they take it in or do they give it to the staff who bring it in? How's that work?
That's a great question. And we've had some challenges with this that our nursing staff has been phenomenal in helping deal with. We are not one of the departments that goes into the patient rooms in order to help preserve the PPE. So we use a Vocera badge to communicate to the nursing staff on the floor saying, hey, we've got a tray for the patient room 221. The ambassador then delivers that tray to that floor and sets it to the nurse's station, makes contact with someone at that nurse's station as a second, say, hey, we've got a tray for somebody. And then when they're able to don their PPE appropriately, and then they can deliver those trays. So, and it's actually a problem that I'm seeing on my listservs. There's every hospital in the nation is struggling with getting food to these patients in a timely manner because not everybody can go into these rooms.
Yeah, good point. Okay, thanks. We're going to go into another spot in the cafeteria here. Okay, we found our way to another spot in the cafeteria with Sandy. Hi, Sandy.
Hi, how are you?
Well, I'm doing all right. It's kind of nice to smell a little food, walk around mid-afternoon.
Great.
Yeah. So what do you do for yourself around here in the cafeteria?
I am one of the room service cooks,
All
which
right.
means I cook the meals that the patients receive.
Okay, all right. So we were hearing about these orders that get put in. They come to you.
They do.
Okay.
Everything that I need to prepare for the patients comes out. It'll print out for me.
Yeah.
It has everything on here that's the hot foods, everything from soups to, we do salmon dinners, we do chicken dinners, things like that.
Okay, all right. So what's for you, like in terms of the work that you do, what's the biggest challenge to getting these things together when the orders come your way?
My biggest challenge is if we are having a very busy day, getting the orders done in a quick manner so that the patients don't have to wait for their meals, and also so that the meals are very hot, very fresh for them to receive.
How quick could we turn things around here usually?
We're usually pretty quick as far as our meals going out. I would say probably 15 minutes to 30 minutes tops usually.
That's nice. That's nice. So by the time they put their order in, the time you get it and it goes out, we're talking 15 to 30 minutes.
Correct.
Okay. How long you been? That sounds like, no, I mean, right now we're kind of low, but I'm sure at times it gets pretty busy.
Yeah, it does depend on patient counts, things like that
Yeah.
sometimes, but at maximum we do 45 minutes.
How long you been doing this?
This is going on my 6th year.
Okay. All right. She's a pro. She's not old. You're a pro.
Okay.
Okay. Thanks, Sandy. Appreciate it. All right. I found someone here with a box. What's it? Deb, I know you. Hey, how's it going, Deb?
I'm frozen. Here, let me show you.
How do you feel?
Let me show you.
All right. It's cold. Her hands are cold. I'm gonna warm them up a little bit here. Yeah. So what are you doing, Deb?
I am doing inventory. We get major deliveries on Thursday morning,
Okay.
and therefore by 5 o'clock tonight, I have to have our requirements in.
Okay.
So I'm working on that right now
Okay.
and finishing up.
I would say your gloves need to be a little bit. Oh.
I've got double duty.
Yeah. I see that. Okay. All right. So Deb, you're the assistant manager here?
Yes.
Is that your official
Yes.
title?
Yeah.
Thought it was. Okay. So we're talking to, she knows what's going on here. So what do you do what's inventory involved?
Inventory means taking count of what's on hand, what are the projected needs for the next delivery, which is Monday morning. We try to not run to the grocery store. So needless to say, having to be organized, plan, know what the recipes entail, talk to the chef, which I do regularly. Yep.
How long have you been working in the food service industry?
Way long.
I think I know it's quite a while. That's why.
About 40 years. 40.
Oh, 40.
40.
40. Okay. All right. Well, Deb definitely knows her inventory.
I try, but some things do get by me, so.
Yeah. All right. Well, I hope I gave you a chance to warm up a little bit.
You did.
Okay.
Just being close to you is.
Oh, warms my heart. Good talking with you, Deb. Thanks.
Okay, thank you so much.
All right. Well, so now we're on the outside of actually our Fresh Cafe.
Mhm.
What's this here?
This is our menu board. So we've got software that allows us to adjust the offerings each meal and then rotate through each day, of course. So we obviously offer our pricing and if something is gluten-free or part of our health transformation program menu, so that those who are trying to follow therapeutic diets have an idea of what might be acceptable for them.
Yeah.
Yep.
So this is HTP. We have a program to try to help folks get healthy here at the hospital. And so we'll outline which one of the entrees or entree multiple ones are HTP. And then GF is
Gluten-free.
Yeah,
Yes,
okay.
exactly.
Okay. All right. Yeah. So, obviously you have your more traditional stuff, but then we have this over here too that kind of,
Right,
Yeah.
our standard items
Yeah.
and things that we're always
and Dana
offering,
could probably
so-
point down at the
Yes.
floor here. You can see that folks do it. We're outside the cafeteria, but folks do end up here
Mhm.
particularly now with the pandemic because of the spacing and stuff like that. So this is nice. So as they go towards the food service line, they have a sense of what they're going to get. And,
Exactly.
Yeah, yeah.
Now that we don't have our salad bar,
Yeah.
it was a really popular thing that we had
every
to.
day.
Oh yeah.
Every day.
Yeah. So
Yeah.
hopefully we'll be able to bring that back at some point. But
I know. I'm looking forward to that.
yeah, so this is maybe more meaningful now because they don't have that option. So they
Right.
really need. And we still offer salads, but it's just in a different different
Yeah.
way. So
Yeah, good. Okay. And so, Carinza, I thought maybe the last thing we would do, just so folks get a sense of things, how they're flowing right now at the hospital, is to kind of just walk through how that works for our folks, and then just the cafeteria itself, Fresh Cafe, how it's set up for folks to eat. So,
Sounds good.
like right now, we don't, no soda. But
Yeah,
anyhow,
I know, right?
anyhow, we have kind of this kind of stuff. And then tell us a little bit more about stuff, Carinza.
Yeah. So, like I mentioned a bit ago, we typically had a salad bar set up from 11 a.m. Through the end of business. So now we offer just box salads and then items that are individually packaged, like cheese and eggs, ham, etc., so that they can sort of build their own salad when it's not the lunch time when we can manually serve that. Dessert case, fresh fruit, yogurt, some hummus and dip, and yogurt parfaits. Additionally, we've got more beverage coolers, things like that, trays for those who do need to eat in the cafeteria as opposed to maybe up in their offices or at their break rooms. So, and then during the 2.5 hours over lunch from 11 to 1:30, this is where our hot food is served. And currently our salad. So, right, social distancing is tough, but we try to make sure that people are spaced. We had about 1,000 transactions every day from 6:30 in the morning to 8 p.m. before COVID.
Yeah.
We're down to probably 600 to 750 or so a day.
Yeah.
So it certainly has impacted.
You bet.
And we can see it ebbs and flows as employees are either allowed to work from home or encouraged to work from home versus whether they're on site, because of course the majority of our customers are our employees.
Sure. Yeah.
So,
And then let's keep going this way. And obviously this is another menu. So as you're coming up here, you get a sense of.
Our salad bar is still intact, but here we're stocking it with some bread items and so some dressings and things like that. We had to shut off our frozen yogurt machines. We're continuing our coffee beverages.
So the other thing here we have is, what's this here, Carinza?
So this is our grill area. So we've always had made to order sandwiches. In the morning, we've got a couple of ambitious cafeteria staff. I'm going to call out Samuel Covarrubias. He's an amazing
He does a great
employee.
job.
He does. He is very passionate about what he serves here. And he crafts these special burritos and these items that employees are able to get. So it's been kind of a nice addition. We have everything from burgers to grilled cheese sandwiches, ham sandwiches, etc., fries, and all the toppings. And then those are things available all day. And we do breakfast items, of course, in the morning.
4 eggs scrambled every morning.
Excellent.
Very good. All right.
Very good.
Okay.
All right.
So let's keep walking. We're gonna. This is where you check out, right?
Correct. Yep. During the busy lunch hours, we still run 2 cash registers to get the flow of our customers through.
This is just as an FYI for our employees. This is kind of a nice little thing. What's going on there, Carinza?
It is. So, and this happened a few years back as well, where we have, if you're a full-time employee, you can use your badge to pay for your meals without having to obviously use credit card, cash, or check. So it's a convenience that's really handy. And I would say
really
75% or so of our transactions are via the employee badge.
Yeah, and if I see someone pulling out money, I go to the other line.
It takes longer. It just does.
That's right.
Yeah.
All right. So now we're going to get into kind of a different look. It's the same area, but it looks different because of this pandemic. And I want you to kind of talk to us about this, Carinza.
Yeah, it sure does. So we are under the same regulations that any restaurant would typically be under during the various stages and tiers of mitigations throughout the COVID pandemic. So as you'll see, we have seating available at some tables, but then we've actually had to put chairs up on other tables with the caution tape to make sure people know not to use those booths.
Yeah.
Additionally, if a booth is ready to be used, we have a system where it's not that sophisticated, but if a table needs to be cleaned, you basically note it, and then our staff knows to go around. Because the turnover, we need to make sure that.
So it's kind of a clean, dirty signage.
Exactly.
Yeah.
And our employees aren't really encouraged to eat in their break rooms right now in small groups.
Yeah.
So we had to keep a few booths open just so that we have staff seating available.
Yeah, for sure. So the governor is changing some of this mitigation stuff. Does that change anything in here right now?
Not right now.
Okay.
We're sort of exempt because we're a hospital. Like we still tried to keep the 6 feet apart and
Yeah.
tables open, but we were allowed even when these restaurants most recently were to be completely closed. We still allow just because we have employees that don't have anywhere else to eat.
Yeah, they need to eat during their shifts.
So we'll
and-
keep things the same now that we're transitioning because it's at 25% capacity. That's what we've been doing all winter.
Yeah,
And
good.
we'll maintain that for now.
Yeah, I can't wait till these chairs are down and these cautions. This stuff is
I miss seeing physical
yeah.
therapy department come
Yeah.
and have their breaks and
right
lunch
there,
breaks.
right
Absolutely.
there.
That's
Every
right.
day they sat right there.
POM guys come and have their
Yeah.
snack, and it's
Yeah.
just, it is very different. And,
Yeah.
you stop and think about it and you're like, oh, man, it's just,
Yeah,
it's,
I can't. I'm really looking forward to the day when I can walk through and hey, how's it going? And sit down
Absolutely.
and chat with folks a little bit. And,
Yeah.
yeah, for sure. Thanks, Carenza. It's been good doing this tour. Appreciate it. And thanks for the good work you're doing.
Yeah. Thank you for coming down and
Yeah.
highlighting our wonderful department.
Glad to do it.